Dr. Angela Hunt. I'm a naturopathic doctor and a Menopause Society certified practitioner, and I practice here in Kingston, Ontario at Kingston Integrated Healthcare. My primary focus is working with women who are in perimenopause or going through the menopause transition. And one thing that I do often is help women understand the risks and the benefits of starting hormone replacement therapy or menopause hormonal therapy. And that's what I wanted to talk about today, was one of the conversations that comes up often in my practice is the question, will starting HRT protect my brain health? Will it reduce my risk of dementia? A lot of women come in and they are concerned about their Alzheimer's risk, dementia risk. They maybe have people in their family who have been diagnosed with this, and it's one of their top concerns. And a lot of times they're under the impression that starting HRT will prevent them from getting dementia. And I'm here to kind of clear the air, or as best I can, on that topic. So we do have some evidence that HRT, particularly HRT given to women who are less than 45. So these are women who go into early menopause, either because of a chemically induced menopause or surgically induced menopause. And we know that those women who go into menopause before the age of 45 have a higher risk of dementia. And in those studies, these are earlier studies, they did show that giving these women HRT seems to protect them or reduce their risk of dementia. However, in 2023, there was a Dutch observational study that showed, they had two arms in this study. One arm showed that was the HRT users and the other arm was non-HRT users. They actually showed that the HRT users had a higher risk of dementia than the non-HRT users. Now, that was an observational study, and we should always give pause there because we weren't controlling for many variables. Maybe there was lots of reasons that women were choosing to use HRT in that study, and those variables were the reason that they had that dementia risk. However, in 2025, the Lancet did a systematic review. This is like a study of studies. So they did 10 different studies that they reviewed in this Lancet article. And they found that the impact of HRT on dementia was neutral. So they found no increase or decrease in risk with HRT with dementia risk. And that's currently kind of where I'm sitting with my patients, is when we look at kind of the body of evidence, I would say that for the most part, we're seeing that HRT does not have a dramatic impact on your risk of dementia. We are seeing that women who are using HRT for more than 10 years might have a slight increase in dementia risk, but I think the jury's still out, and I'm hoping for more research to come to kind of clarify that. So right now, how I would say it was that the impact is neutral. HRT is not going to protect you from dementia, is not going to increase your risk of dementia. And this is important for women to know, because you don't want the reason for you to start HRT to be protecting your brain health. I don't think we have enough evidence to justify that. There might be a lot of other reasons you're starting HRT, but you don't want that to be your sole reason. As always, I think when starting hormone therapy, that needs to be an informed consent conversation with a health provider who's knowledgeable and that you trust, so that you can decide, is this the right decision for me? Does this make sense for me where I am right now in my health journey? I hope this was helpful. I'm going to put links to the studies that I mentioned here, and thanks.